Hello, this is Ruben Major. I'm an instructor, program director for Arizona, and chief executive officer for EMS University. In this particular section, we're going to be discussing the ongoing assessment. This is an extremely brief section. The purpose of this particular section is just to reiterate the ongoing assessment for you. The ongoing assessment is basically what we are doing when we are evaluating and reevaluating the patient's condition. The purpose of it is to determine if there are any changes in the patient's condition, also to identify if there's any missed injuries or conditions that might be present, and to assess the effectiveness of our treatment and adjust if we need to. So basically, we are looking for any holes in our examination process or any problems that we might have had with the gaining complete information as far as the patient interview process was concerned. And then also, we're really trying to gauge and start the trending process. So in the trending process is really what determines whether or not our treatments are effective and whether or not when we're finished with the entire patient process, we did a good job. So we want to, again, assess the effectiveness of the treatment that we've given and make adjustments accordingly. The ongoing assessment is performed on both the trauma and the medical patient. So the procedure is to repeat the initial assessment, reassess the vital signs, and repeat the focused assessment. We want to check our interventions. So again, the procedure is to repeat the initial assessment. So we're going to go through what we did in our initial assessment, which we discussed in that particular section, and then look at the vital signs again. Remember, if you have an unstable patient, you're doing vital signs every 5 minutes, and if you have a stable patient, you're going to be doing vital signs every 15 minutes. We are going to repeat the focused assessment, so we're going to be looking at the same assessment area that we were looking at before and in great detail. So we'll ask follow-up questions as well, anything else that might come to mind in the conversation that we have with the patient. It's not just an interview, but this is a conversation. This is an ongoing communication that you're having with the patient to make sure that you are getting the information that you need in order to more adequately assess the situation. And then checking interventions. So this is perhaps the most important part of doing the ongoing assessment. That's the trending process that we're getting started. So when we have the baseline set of information, not just baseline vital signs, but baseline information in general, we have a standard of measurement upon which we're going to be making or measuring things, I guess, against. So when you go through this ongoing assessment, you're really kind of gauging to see what kind of changes have been made from the initial baseline and trying to see whether or not the treatments that you've made have been effective, or whether the patient's getting better or the patient's getting worse. And if you have done any interventions, what have these interventions done for your patient? Have they made a positive impact, or have they made a negative impact? Or maybe there's something that's going on, just kind of, these are sort of things that you keep in the back of your mind, but maybe there's something going on that you're not thinking about. And so in this particular area, we want to really make sure that we're honing in on that stuff so that we can give the patient the best possible chance. And that will do it for this particular section.